If you take amlodipine, here's a question almost nobody asks you at the pharmacy counter. Do you know the one fruit that can turn your normal dose into an overdose? Or why standing up too fast off the couch could actually be dangerous for you specifically? Most people walk out with a bottle of pills, a label nobody reads, and about 90 seconds of rushed advice from a doctor who's already thinking about the next patient. That's not enough. Not for a medication this many people rely on every single day. In the next few minutes, I'm going to walk you through 5 specific things to watch out for if you're on amlodipine. Not to scare you, but so you can take it the smart way, the safe way. Stick around, because point number 4 is the one almost nobody tells patients about, and it could be quietly working against everything your medication is trying to do. Before the 5 things, a quick 60-second refresher on what amlodipine is actually doing in your body. Amlodipine belongs to a family of drugs called calcium channel blockers. Picture the muscle lining your blood vessels like a fist gently squeezing a hose. Calcium is the signal that tells that fist to clench. Amlodipine blocks that signal. The muscle relaxes, the vessel opens up, and blood moves through with less resistance. Less resistance means lower pressure. That's why it's one of the most prescribed blood pressure medications on Earth. It's taken once a day, it's generally well tolerated, and it doesn't come with some of the rougher side effects of older drugs. No persistent dry cough, no crushing fatigue. But because it works by relaxing blood vessels everywhere in your body, not just the ones controlling blood pressure, it comes with its own specific quirks. That's what today is about. The first thing, be careful with grapefruit and grapefruit juice. Here's the mechanism in plain terms. Grapefruit contains compounds that block an enzyme in your gut called CYP3A4, an enzyme whose job is to break down amlodipine before too much of it reaches your bloodstream. Block that enzyme, and more of the drug slips through. This excess amlodipine can cause your blood pressure to drop too low, leading to symptoms like severe dizziness, fainting, and headache. It's the pharmacological equivalent of accidentally taking a higher dose than your doctor prescribed. Practical example, say you have a grapefruit at breakfast and take your amlodipine an hour later, thinking you've spaced it out. That doesn't help. The enzyme stays suppressed for up to 24 to 72 hours. There's no safe gap to leave between the fruit and the pill. The fix is simple. Skip grapefruit and grapefruit juice altogether while you're on this medication. Oranges, lemons, and limes are fine. Pomelo and certain bitter oranges are not. Treat them like grapefruit. If you genuinely love grapefruit, ask your doctor if there's an alternative blood pressure medication without this interaction. You don't have to just accept the loss quietly. The second thing, watch how quickly you stand up. Amlodipine relaxes vessels throughout your entire body. Normally, when you stand, your legs' blood vessels tighten to push blood back up to your brain against gravity. On amlodipine, that reflex is blunted, so there's a brief window where your blood pressure dips and you feel lightheaded, or in some cases, you actually stumble or fall. This isn't a minor annoyance for older adults. A fall from this kind of dizziness can mean a hip fracture, a head injury, a hospital stay that changes the trajectory of someone's life. Practical fix, step by step. Waking up? Sit on the edge of the bed for 30 to 60 seconds before standing. Getting up from a chair. Use your hand on something stable and pause before you take your first step. Just had a hot shower? Heat amplifies the blood pressure lowering effect. Sit for a moment before you stand. Stay hydrated. Dehydration makes every one of these dips worse. If you're having real dizziness or near falls, that's not something to quietly push through. Tell your doctor. Sometimes it's a dose adjustment. Sometimes it's a different medication entirely. The third thing, be thoughtful about alcohol. Not necessarily abstinent, but thoughtful. Alcohol lowers blood pressure in the short term, which stacks directly on top of what amlodipine is already doing. More dizziness, more fall risk. It also dehydrates you, which makes standing up safely harder. And over the long run, heavy drinking actually raises blood pressure, working directly against your medication's job. Practical example: 1 glass of wine with dinner is generally fine for most people on amlodipine. But if you have 2 or 3 drinks and then get up in the middle of the night to use the bathroom, half asleep, in the dark, that's exactly the scenario where a fall happens. The combination of impaired balance, dehydration, and a blunted blood pressure reflex is a genuinely risky mix. The rule of thumb: moderation, up to 1 drink a day for women, up to 2 for men, and extra caution around movement after drinking. The fourth thing, and this is the one that surprises the most people, is what else is in your medicine cabinet. A few categories to know. Certain antibiotics, like clarithromycin and erythromycin, use the same enzyme pathway as grapefruit and can spike your amlodipine levels. Over-the-counter painkillers like ibuprofen and naproxen don't interact through that enzyme, but they independently raise blood pressure, meaning regular use can quietly cancel out your medication's benefit. Cold and flu remedies containing pseudoephedrine or phenylephrine are decongestants that directly raise blood pressure. Read the label, it's often not obvious. Herbal supplements. St. John's wort can reduce amlodipine's effectiveness, and real licorice root can raise blood pressure meaningfully. Practical example: someone manages their blood pressure well for years, then starts taking ibuprofen daily for knee pain. Months later, their blood pressure readings creep up, and they assume the amlodipine stopped working. In reality, it's the ibuprofen quietly working against it the whole time. The fix: use one pharmacy if you can, so your pharmacist can cross-check everything. Tell every prescriber about every medication and supplement you take, even the ones that seem too minor to mention. The fifth and final thing: don't just live with ankle swelling. Amlodipine can cause fluid to accumulate in your lower legs and ankles, worse by evening, often gone by morning. Many patients assume this is just getting older and never mention it to their doctor. But it's medication-related, and there are real options, practical options that actually exist. Lowering the dose, since the swelling is dose-related. Adding a different blood pressure medication, like an ACE inhibitor, that can counteract the swelling while improving overall control. Switching medications entirely, if the swelling is significant. Simple measures: elevating your legs, staying active, compression stockings if appropriate. The point isn't to suffer in silence. Swelling, new dizziness, palpitations, or other symptoms that started after you began the medication are information your doctor needs, not something to just accept. One last thing, and it matters more than any of the 5 points above. Please do not stop taking amlodipine on your own because of anything in this video. Stopping suddenly can send your blood pressure climbing fast, and for some people, that's genuinely dangerous. The path forward is always a conversation with your doctor or pharmacist, never a decision made alone at home. If this helped you, share it with someone who's been taking this medication for years without ever hearing any of this, and let me know in the comments, which of these 5 surprised you the most?